Hi, my name is Dr. Jason Mavor. I'm the chiropractor at Mavor Chiropractic in Watertown, Massachusetts. So this is an easy way to both sort of strengthen and stretch. There's a variety of ways to modify this, but I'm going to show you a very simple way to both activate and stretch this group of muscles from your knee basically to your rib cage. So all you need is a flat raised surface. It could be your couch, that might be a little more challenging, your bed, any kind of bench. You can do it in an exercise bench at the gym. And you simply, all we're going to do is we're going to lay on our back. And again, the idea of this is to work your hip. So if you're on your bed, put pillows under your head. You can lay flat if you'd like, but the emphasis again is on the hip per se. So I don't really care how much you work the other parts. I want you to relax them. So there's two ways to do this. You keep both your knees bent at 90 degrees. You can just rest your hands on your stomachs. The initial progression is right up to the edge here. So I'm only half of my buttock is off the edge here. I bring my knee to my chest, I straighten it out, and I slowly let it lower. Now, it's okay if it touches the floor, but the higher you are, the more you can let it dangle and stretch. You repeat. You bring your leg up, straighten it out, almost like a slow bicycling motion. Now, sometimes people will talk about or complain of a popping in here or a snapping. Often that's just a tendon in the hip rolling over one of the bones in your joint. If it hurts or gives you concern, it could be something else. By all means, come on in. We'll evaluate your hip and so forth. Now, the other thing you can do, because the thigh is a group of large muscles as well as the hip flexors deep in your body, you can change the angle of your leg a little bit. So you can bring it up and out. You can bring it up and in. You can rotate your foot as you go through. So it's like this kind of motion. You can turn it in. So it's like this kind of motion. The hip is a big, giant bunch of muscles here. Now, to increase the stretch and also work both hips simultaneously, you take your hands and you hold your knee to your chest, and the opposite knee rather, and you bring your knee up and you do the same sort of thing. Now, in this case, obviously, my head's coming up because I'm torsioning my body a little bit more and compressing. But again, over and through. And at the end, you let it dangle, or you can just work it through. So this is simultaneously strengthening and stretching. Now, if this is effective for you, but you want more, you can add a small weight to your foot. You can put an ankle weight. You can even just take like a tote bag or a shopping bag and put a can of soup or beans, something very light, 1 or 2 pounds. Because remember, as strong as your leg is, you put a weight at the end of it, it becomes exponentially heavier. And when you're stretching through here, that weight will increase its load as we go through. To further increase the stretch, if you're so inclined, you take the arm on the same side and stretch it up over your head. So here I have the advantage of this table, but I hold one knee up and I bring it down. Now, by bringing my arm up over my head, I'm stretching some of these core muscles even more, and I increase that stretch to the interior of my hip. And again, I can turn my foot in, I can turn my foot out, I can change the angle a little bit. There's a lot of muscles both on the top of my thigh and the interior of my core here. Plus, as an added benefit, you're also stretching and strengthening some of these abdominal core muscles a little bit as well. Now, to reiterate, if there's any severe pain or anything that makes you uncomfortable, stop. Stop right away. And if it concerns you, then, give us a call. Come on in. We'll evaluate your hip, make sure that there's nothing more severe, and if there is, we'll treat it accordingly. Or otherwise consult, an orthopedist or a physical therapist or some exercise specialist that can evaluate hips to diagnose whether or not it's just a muscle weakness or strain or something more serious that needs to be dealt with. So one of the other variations with this exercise is, again, as I'm showing you this, my leg is kind of going straight through the motion. My leg is straight, my foot is pointed toward the ceiling. But because the hip and the upper part of the thigh are a large group of muscles, you can change the nature of the stretch and the work by rotating your foot either out, and as I bring my leg down, the interior of my thigh is getting the stretch at the end, or I can turn my foot in towards my body, rotating the hip in, and then relax, and will stretch the outer part of my thigh. Plus, the hip flexors in the abdomen are oriented in different directions. So by turning out a little bit, I focus on some strengthening and stretching, or if I turn it in, I focus on strengthening and stretching those opposite hip flexor muscles. You don't need to do any of those extras, but if you're trying to complete or focus on certain parts of hip flexibility or tightness, you mix it back and forth. Again, when you're doing these exercises, if there's any real pain or something that concerns you, if there's any motion or mobility that causes a sensation that bothers you in some way, then just stop. Give us a call. We'll evaluate it. We'll determine whether or not it's something that's serious or not and treat it accordingly. Otherwise, please contact an orthopedist or a physical therapist, some exercise specialist that knows hips, and they can evaluate it accordingly and help you make sure you can do the right things and get back to whatever activity you'd want to do.